In the fall of 1964, I got a job at the OHSU hospital on the acute psychiatric ward. And it was very much a teaching ward. And they had maybe 20 or so patients at a time. And they weren't expected to stay there a long time, like the state mental hospital where I'd worked uh, a couple of years before. And there were a lot of people there being trained. I think there were 4 or 5 psychiatric residents and a couple of psychology residents, um, and it was very much with the fad that was afoot at that time, which was like called community therapy, um, and they wanted to get away from just having the psychiatrist do everything, because somebody studied treatment of mental patients and discovered that the people who were around the patients most hours during a day were the least trained, the psych aides. I was a psych aide. So they were wanting to have everybody trained so the psych aides would be more helpful and therapeutic. As part of that study, they discovered that as you went down the totem pole of training toward being the people who were with the patients more hours a day, you also found they had less training, but they also tended to have more rigid and authoritarian attitudes about mental illness. And so many people who have very little training thought that mental illness was caused by being evil, a la the movie One Flew Over the Cuckoo's Nest. So when I was there, they were having lots of group meetings and group therapy sessions, and they were telling us least trained people some of the concepts, like not being judgmental and about helping people talk about their concerns, rather than just giving them drugs and locking them up. Well, uh, along that line, uh, the I got very involved with this and loved it. I had my little BA in psychology. I'd tied, no, I was second highest grade in the final exam of abnormal psych I'd taken as a senior. Uh, Actually, one fine day, a phone call came in. Nobody called you in those days when you were at work. Uh, and it was my abnormal psych prof. And he said, well, you've asked me for a recommendation to go to a psych graduate school, but I can do that, but I'd rather give you a job. Oh, yes, I'm the director of residential living at the new Job Corps Center that's about to open. And I ended up being the first counselor hired there months later. But that's not the story I want to tell. I want to tell the story about the day that a young man, who I will call Bob Larson, I called him that in a paper I wrote about this once, uh, came in one day, and his mother was with him. And she said, this is Bob. He can't talk. This is Bob. He can't walk. And he was obviously so infantilized by what was going on in his environment that he could hardly breathe. And here he was. As I got to know him, I found out that he was second highest competitor in the half mile in the state of Oregon the year before. And something had come along, and he'd had an acute schizophrenic break, which is somewhat classic for people about his age that are going to get schizophrenia. They frequently get it when they're pretty young. But we started trying to use community therapy with him a little bit by including him in activities, and but the doctors there were freaking out because his father was the driver for our then governor. And our then governor was very religious, Mark Hatfield, and the story was that they would stop along the road and pray together. But when the son got schizophrenia, they had to cure him instantly if they had to kill him to do it. And I say that because I had to stand by while a psychiatric resident who didn't know what the hell he was doing, never done it before, sticks a needle as big as the lead in a lead pencil into this poor guy's back to get spinal fluid out, to test his spinal fluid. My God, you think there's spiral sheets in a 16-year-old kid? But then they decided they were going to have to give him electroshock therapy. Well, the common knowledge at that time was electroshock therapy was pretty ruthless and not very useful. Years later, it gained a kind of a recovery and started being used again. But at that time, it was agreed that it was horrible, punitive, but they gave it to him, and they started zapping him full of every drug in the universe, turning him into somebody that was, after his mother left, he calmed down a little bit and he started talking and didn't seem, yes, he was having delusions, but he could also talk sense too. So I kind of, since I'm a boy, he was a boy, I kind of paid special attention to him. And when we went out on some little field trip, very short field trip, like part of a day, he started confiding in me. And he told me that he'd been, I don't know if I want to use the word raped, sexually abused, and that he was horribly ashamed that that had happened. And he just started pouring his heart out about how upsetting this had been. And it happened just before he had this schizophrenic break. And so I came back to the hospital and told the chief nurse there, Renata Whitaker, what he told me. Oh, we can't talk about that. Oh, don't talk about that. Don't talk about that. So about that time, it was a little before that, I came down the hall, approaching his room, and I heard, help, help. And I rushed into the room, and he was hanging by the ledge of the window. We were 4 flights up. He was hanging there, and this is the only time in my life, I guess, I've ever rescued anybody, but I grabbed him. It was pretty easy to lift him back in, but he was at a lot of risk there. Well, after they said, no, we can't talk about this, a couple of days later, Bob disappeared. And I don't know if he, as far as I know, he was never seen again. Fear of talking about homosexuality. Thank God we've moved so far beyond that now. If somebody said that now, one or more of the therapists there would say, well, let's talk about it, you know, and before long, they would be talking about it in the group, but not then. Oh, don't talk about that. Fear of homosexuality in the mid-60s in Portland, Oregon.